Hey pals, how are you doing? A while ago I asked you to ask me questions about my hysterectomy and I'm finally getting round to answering those. Sorry about the light in advance. This is the only kind of place in the house that looks cute at the moment. For those of you that don't know, I am a 23-year-old trans guy living in the UK and I had a hysterectomy about 2.5 months ago. I had it on the 12th of November. I had a total laparoscopic hysterectomy, so they got rid of my cervix, my uterus, my ovaries, and my whole reproductive system, and they did that through using instruments through 4 holes, including my belly button, and so it's all very minimally invasive, and I'm pretty much recovered now, so I feel like I'm at a point where I can answer most of the questions that you asked. The first question is from Noah Hector, who says, what made you decide to get a hysterectomy? The main thing was the health side of having my reproductive system whilst being on testosterone. I don't think there's currently any proof that being on testosterone without having your reproductive system taken out for longer than 5 years is detrimental to your health, but I figured since I don't really need it, I don't feel like I have a connection to it or like I necessarily want it, the sooner it's gone the better. In the UK, if you're going through lower surgery, they tend to do it in stages, and in your second stage they do hysterectomy alongside other parts of your lower surgery. For my lower surgery, I still need to lose quite a bit of weight, and I don't know how long that will take, so I thought having a hysterectomy beforehand will give me something to make me feel like I'm progressing in my medical transition and not really have to worry too much about having my ovaries and stuff still. I was also getting cramping in my lower abdomen, not too often, but often enough that it was uncomfortable, and if there was a solution for that, then I would go for it. Since surgery, I haven't had that cramping sensation, so I'm assuming that that was the cause of them. They also asked if I felt weird knowing that something was removed, or if it just feels like I'm on the way to having a body that represents who I really am. Honestly, physically, I don't feel any different. It doesn't feel like there's a space inside of my abdomen or like things are rearranging. It might have felt a bit like that in the first couple of weeks of recovery, but now it just feels basically the same as it did beforehand. I don't feel like my uterus or ovaries or cervix or anything like that kind of changed the way I saw myself, because I couldn't see it and it wasn't bothering me on a daily basis, but knowing that it's gone, it's just a relief. Samuel Smith says, what's your biggest tip you have for preparation now that you look back on it? If I could do it again, I think I would eat healthier leading up to it and focus a lot more on mindfulness and meditation, because a lot of the recovery process is doing nothing, and if I could do nothing comfortably beforehand, it might have been a bit easier. I also think it would have been a good idea to have a watch list or a list of things that I could do if I was feeling really bored or isolated. A few people asked about the pain, discomfort and moving around, especially relating to top surgery. I'll say that top surgery was very painless for me. If I could score it out of 10 for pain, it would probably be a 0.5. I didn't feel much pain at all. I didn't feel much discomfort, and the only reason I couldn't really move around was because my chest was tight and I just knew I shouldn't. Because the hysterectomy was around my abdominal muscles, you kind of have to take it a lot slower because a lot more is at risk, if that makes sense. I'd say that the pain was probably about an 8 out of 10. Not necessarily my stomach area, but the rectal pain that I felt was horrendous and the worst part about recovery probably. The discomfort came from the swelling that was inside of me. I said it before, but I felt like there were 2 expanding balloons either side of my abdomen, and that's kind of the best way I can describe it. When it came to moving around, I felt like I could do it, but I didn't want to do it too much because I didn't want to jeopardize my healing. It wasn't that I was in constant pain and discomfort, it was more like I have to stay still for this period of time, otherwise I will affect long-term outcome of this surgery. Theo Dainty says, how do you feel since you've had your hysterectomy in terms of dysphoria? I don't think I had that much dysphoria relating to my hysterectomy. I had enough obviously to get rid of it, but it wasn't something I thought about daily. It wasn't something I cared about as much as top surgery or lower surgery. It's more of just like thinking it was a nuisance. It's nice to not know that I don't have to worry about getting pregnant or getting cervical cancer or needing smear tests and things. I think because I couldn't see it physically and it didn't affect me every day, it didn't have that much of an impact in terms of dysphoria. Again, a few people asked what kind of help and support I needed from other people after surgery and what support they can give to their loved ones after surgery. So physically, I needed help with basically everything. I needed help with cleaning, cooking, putting my surgical stockings on, sometimes changing, sometimes showering. It was just difficult to do things on my own, and I don't think I would have been able to do it if I didn't have support. Theo has a litter tray that needs emptying, and I couldn't do that for a good few weeks. I just couldn't really do anything, and I just had to accept that it was not my fault and that I couldn't control it, because that was something that I really did battle with emotionally. I think what helps when you're dealing with that is being reassured that you're doing great and that you're doing the best you can and you're not being selfish for not doing things, and it's not because you're just lazy or because you can't be bothered, but it's because you're recovering from something major. And it helped to know that other people did it because they wanted to rather than because they had to. Other things that really helped were just getting well wishes from other people and people telling me they were proud of me and getting cards from my friends. It just made me feel really loved, and when you're feeling that vulnerable and nervous and anxious about things, it helps to have people thinking about you and just sending you well wishes. Elijah Acia, I'm really sorry if I've said that wrong, says, what would happen if you ever quit hormones now that you've had a hysterectomy? I looked this up because I wasn't entirely sure and there's not that much information about it. Basically, my body would go through menopause. I think it is kind of going through a bit of menopause at the moment, but it wouldn't be as severe as if I wasn't taking testosterone. So physically, the permanent changes from testosterone would probably stay, like my voice, maybe my hair growth, like on my face and my stomach. It might get a bit thinner, but I don't know if it gets thinner because of estrogen or if it's thinner because of a lack of testosterone. Also, genital growth probably wouldn't change. I've written down menopausal symptoms, which are hot flushes, night sweats, difficulty sleeping, reduced libido, problems with memory and concentration, headaches, mood changes, palpitations, joint stiffness, aches and pains, reduced muscle mass, and a recurring UTI. If you're not on testosterone but you do want a hysterectomy, I think it's an option to take estrogen. I think that's what a lot of people do anyway if they're not on testosterone and have a hysterectomy. Zane Walker says, does your body feel different, and if so, how? I don't think my body feels that different at all. I was kind of like wondering whether or not I would feel an empty space in my stomach, but that hasn't happened. It doesn't feel like anything's moving around, like I said before. That guy Branson says, have you noticed any further changes from after hysterectomy, like hair growth, voice dropping, muscle increase, emotional changes, confidence changes, weight loss, or fat distribution? The things that I've noticed most are my facial hair and body hair increasing. Before my hysterectomy, I kind of had really thin hair up here, like peach fuzz, and now it's kind of getting darker, and I feel like that is because of my hysterectomy. Also, Paul's noticed that my abdomen hair, it was shaved for the hysterectomy, but it seems to be growing back dark and thick, and I'm not sure if that's just because it's shaved, but it looks like it's coming back and I'm not complaining. Caden Brady says, if you had a catheter after, was it really painful, or did they numb it before using it? Did it hurt to walk around? I did ask before I went into surgery because I needed the toilet sort of before, and I was like, should I go now or is it gonna be fine? The nurse said that I'd be catheterized before they do anything, just so my bladder is empty. When I came out of surgery, there was no catheter in. The only reason I had to have a catheter was because I couldn't pee 4 hours after surgery. When that happened, I was told to just lay down on the bed, and I don't think there was any numbing cream. She didn't say anything, but I was kind of out of it at that moment, so she might have. Having a catheter in didn't hurt, but it felt like I was kind of just shoving a watermelon into my nostril. Or maybe not a watermelon, but more like a really thick sausage. After my bladder was emptied, she took the catheter out and I didn't need it again, ever. And I could pee 4 hours after that, so it was fine. Ashton Daniel says, did you have to deal with doctors telling you you're too young and might change your mind? I thankfully didn't, but I know that it happens fairly often, which is really frustrating. The surgeon I had was really great. As soon as I went into the appointment, he was just really nice and said, what do you want it for? This is the kind of thing we do. You can choose from this, but I recommend this. Most people do this. If anyone is interested in seeing him in the UK, his name is Tony Chalhoub. I think I'll maybe leave his information in the description, but he does the majority of the northern region of UK for hysterectomies, and he's worked on quite a few trans men, I think. He was also really thoughtful when it came to dysphoria and asked whether or not I would be okay on a woman's ward or if I wanted to be alone, and what kind of things they could do to make me feel more comfortable, which I really appreciated. The Robonator says, how long was the recovery? On paper, I think it was 6 to 8 weeks, and originally I got given a sick note for work for 4 weeks, but they said after 4 weeks, go to your doctor, and if you don't feel ready, ask for another sick note. And that's what I did. Komaribi, sorry again for being terrible at pronouncing things, says, how was it like using the toilet after the first few days and weeks? The first time I used the toilet, I think I said before, was 4 hours afterwards, and I couldn't push at all. I sat there and I bled a bit. I stood up after that and nearly fainted, and my blood pressure went really low, I think, and it was just not very nice. 4 hours after that, I wasn't really able to push, but I could pee. I could just sit there and be really patient and let it happen. After about 3-4 weeks, I think I was able to push like normal and just do it fine. Last question is from Liam Rubin, and they say, how is it with testosterone now? Are you more moody before a T-shot? I have my testosterone injected by a nurse every 18 weeks, so I haven't actually had it done since my hysterectomy. I don't think I've noticed being moodier as I'm kind of leading up to my injection. I think it's due in a few weeks. But I have noticed that I have been quite low in terms of my mood, and I'm not sure whether or not that's a sign of my regular depression, or if I've got a bit of post-op depression, or if I'm just moody because I'm due my testosterone shot. I think it's quite unlikely that it's because I am coping less with my testosterone. I think it's more depression. Those are my questions, and I hope I gave you some idea of what it would be like to have a hysterectomy. I want to thank Sol, Mark, Bex and Oliver for supporting me on Patreon. You're great. I appreciate you so much. I hope everyone's having a great day and a great week and a great month and a great everything, and I will speak to you soon.